Laura Packard drops by to discuss the loss of health care by 1,000 cuts and the Affordable Care Act. Check it out, leave your comments, ding the bell, share it with your friends, and subscribe to our channel. Thom Hartmann here with you, and on the line with us is Laura Packard. Laura is a healthcare advocate and the founder of Healthcare Voices, which is a nonprofit organization that works with adults with serious medical conditions. The co-chair of the Healthcare Voter Group and runs the Pharma Accountability Campaign for the Hero Action Fund. Also a cancer survivor. Healthcarevoter.org is the website. The Twitter handle LPackard or Healthcare Voice or Healthcare Voter, your choice. And Laura, welcome to the program. I know that the Affordable Care Act enrollment period is coming to a close soon, and you know, the kind of the main topic we wanted to talk with you about. Tell us about this.
Sure. Well, in most states, the deadline is December 15th, which is Tuesday. But in every state, if you want a policy that starts on January 1st, you should sign up now, and you can start at healthcare.gov to see what your options are.
Now, I understand that the Trump administration has thrown some roadblocks in the way of people signing up for the Affordable Care Act. I've seen various stories over the course of the last 4 years, frankly, and I confess I don't remember all the details. It seems like they were messing with the website, like they were they zero funded the promotion or reduced the funding for promotion of these things. What's the situation with the state exchanges and the ability to sign up for the ACA?
You're exactly right. For the federal exchange, which is what the administration controls, at first they cut down the Sunday hours the first year, and they slashed the marketing budgets. So that means that many people are not aware that they can get a cheap or even a $0 plan because the Trump administration was not able to destroy the Affordable Care Act via Congress. Instead, they've been going after it with 1,000 cuts here and there. And even in the midst of a pandemic, they're still trying to take away the Affordable Care Act. It's going to the Supreme Court next year. But for right now, it exists. It is in action, and people should go to healthcare.gov to see what policies are available.
Right. Yeah. And at the state level, what's happening? Because these programs are administered by the states, aren't they? Don't if you go to healthcare.gov, don't you get rerouted ultimately to a state portal, as it were?
It depends. Some states, like I live in Colorado, and so we have a state portal. So if you go to healthcare.gov, it will send you to the Colorado exchange. Most states don't have a state exchange, but some do. And states that have their own exchange, like Colorado, like California, like some others, they may have a later deadline for signing up. But you should start at healthcare.gov, and it will route you to the right place if you live in a state that has a state exchange. And some states set up their own exchanges to mitigate some of the attacks coming from the administration. But we'll have to see what next year looks like, because next year we're going to have somebody in office that supports healthcare instead of trying to take it away.
Yeah, and I think most people don't even realize, I mean, everybody gets it right now who watches any television at all, that if you're over 65, you now qualify for one of these scam programs called Medicare Advantage. For privatized health insurance, you have to surrender your Medicare, and in many ways surrender your right to Medicare in the future. To buy into one of these Medicare Advantage plans, it's just a screaming disaster for so many people. But they offer $0 plans. Everybody knows that. You just mentioned $0 plans for the Affordable Care Act. The Affordable Care Act is heavily regulated by the federal government, and you don't generally get scammed. They can't dump you or cut you off or do what's called lemon dropping or cherry picking with the Affordable Care Act. Am I right on that?
Right. And before the Affordable Care Act was in place, insurers used to do something called rescission, where if you ever had something serious happen to you, you got sick, had a terrible accident, they would have their lawyers go through your insurance plan with a fine-tooth comb and figure out that you didn't report that you had acne in high school or whatever. It was worth it to them to have lawyers figure out how to deny you your insurance coverage. But the Affordable Care Act put protections in place to make sure that everybody can get insurance and can keep insurance. And it's by no means perfect. There are plenty of people that make just a little bit too much money to get help, but still health insurance is out of financial reach. But everyone can get access to a plan through the Affordable Care Act. Insurers can't refuse to cover you like they used to be able to do. And as a stage 4 cancer survivor, no insurance company would ever choose to cover me if they didn't have to.
Yeah. Yeah, I mean, this is bizarre. And then Trump rolled out this thing called Trump Care. Under the Affordable Care Act, there is a provision that if you lose your job and you had health care through your job, you basically had two choices. You could use COBRA to continue that health care plan, or you could sign up for up to 90 days, as I recall, and please correct me if I'm wrong in any of the details of this, that you could sign up for 90 days for a short-term, basically emergency plan that would cover, just a crisis, a car accident or something. But those emergency plans, those short-term plans, they were a lot cheaper than COBRA, but they also were not, under the Affordable Care Act, they were not covered by all the provisions of the Affordable Care Act. So if you got sick in certain ways that involved things like pre-existing conditions, they could drop you or refuse to pay for part of it. They could have all kinds of, wild exceptions and exemptions. And Trump extended that 90-day period to, several years now? And, I've had people call into this program saying, I just got offered a Trump Care program for only $112 a month, and it covers millions of dollars worth of... And I'm like, you don't want that. Can you speak to that?
Sure. Well, they extended it out to a year. But
a year.
There's... Yeah, you should not sign up for one of those short-term plans if you can get good health insurance, because, again, they can choose to cancel your policy. They don't have to cover essential health benefits and so on. There aren't the regulations on those plans. So they look cheap on the surface, but if anything ever happened to you, they might not cover you at all. And so that's why if you do lose your health insurance through losing your job, that is a qualifying event to be able to sign up for insurance through the Affordable Care Act, no matter when it happens. Open enrollment ends in most states December 15th. But losing your job and losing your health insurance qualifies you, just like moving, and there's some other events that also qualify you to go back onto the exchanges. So always read the fine print. If it looks like an incredible deal, there's reasons for that.
Yeah, exactly, like with Medicare Advantage. So, Laura, we just have 30 seconds here. Just recap for people when the Affordable Care Act enrollment period closes and what people need to do.
Okay. Different states have different deadlines, but just to be safe, go to healthcare.gov on or before December 15th, which is Tuesday, and get started and look at your options. And even if you've looked in the past and it wasn't